Okay, so we're back to finish up some muscles doing gravity minimized position for the shoulder and shoulder girdle. The first one I'd like to do is anterior deltoid, gravity minimized and side lying. So I'm going to support my patient's extremity, aligning my arm with his arm. We have to support the humerus and the forearm at the same time. So, and of course, palpation is going to be at the anterior deltoid here. So the action, of course, is flexion. So I'm going to show my patient what I would like for them to do first, passively. And then I'm going to palpate and have the patient do the action. So can you do that for me, that action? So I'm just supporting as he raises his arm into flexion, okay? So right now his grade is a 2. So of course that's gravity minimized, full range of motion, no resistance. So now I'm going to put resistance, going to be anterior on his humerus, his distal humerus. And I'm going to do that resistance throughout the range for a 2+. So can you do that one more time? I'm going to give you some resistance throughout the range. Good, all the way and back. Good. So now he's a 2+. Okay. So next, I'll just make sure I get them all. That was anterior deltoid. So now we'll do latissimus dorsi. So latissimus is extension. So again, we're going to support, and I'm going to show him the action I would like for him to do. You can flex the elbow, makes no difference. Okay. Now my palpation has to happen. I'm at a 2, so I'm going to ask him to do that motion I just showed him. So go ahead and bring your arm all the way back, and I'm supporting his full upper extremity again, and that's a 2. So for a 2+, I'm going to move my palpation hand to his posterior humerus, distal, and we're going to do that motion again with some resistance for a 2+. So do that motion again for me. Good. Excellent. All right, so that is gravity minimized position. Okay, so middle deltoid is next. I don't think we did middle deltoid yet. So can you roll onto your back for me? Alrighty, you can rest here. Okay, so for gravity minimized position, it's going to be supine, and I'm going to show him now. Make sure that you externally rotate. The shoulder needs to clear, no impingement. So make sure the humerus is rotated, not just the forearm. Okay, and the action is abduction. So this is the motion I would have him do. I'm going to support his entire extremity the whole way. So for palpation, usually, actually, can you come towards me, Matthew? Trying not to hit the wall, limited space here. Come a little bit more towards me. Thank you. Okay. So if I support the entire extremity, I can palpate with one hand and support with the other. And if I have him do that, actually I like to do it this way. Okay, have him a little flexed. All right, so do that motion for me. Good, and come back. Excellent. I know some people do this hand hold, which is fine. You can do it this way. All right. It's hard to use both hands because you need that palpation hand. So, but once they've done the 2 and you've palpated, now you can move your hand. You don't need the palpation anymore, you just need resistance. So the resistance is going to be the lateral distal humerus, and you can do that one more time for me. See if you can take resistance for a 2+. And he's not even letting me support him. Okay, that's fine. All right, so that was 2+. So the next one I'm going to do on my list is pec major. I don't think we did that one. For against gravity position. Where we stopped. So for against gravity position, I'm going to have him at 90-90, and he's coming across his body. And to here would be fighting gravity, so we need gravity for a 3. I don't let him go further because obviously we'd need those muscles to slow down from dropping the posterior delt, so we're not using pecs anymore. So, okay, Matthew, the motion I would like for you to do is from here to here. Okay? Can you do that for me? So again, this is against gravity, so he just fought it all the way. That is for pecs, okay? So now I'm going to do a break test. So my stabilization hand is his opposite shoulder, and distal humerus, I'm going to come in that mid-range, that halfway range, and then my resistance is going to be on the distal humerus anterior portion. So come on up, meet my hand, don't let me push you down. Ready? Hold it, hold it, hold it. Ah, he's a 5 out of 5. Okay, good job. That was the first break test I did on you. Okay. All right, so the next one I'm going to do is your against gravity position for infraspinatus teres minor and also subscapularis. So I'm going to have you flip onto your belly. All right, so come up a little bit. I'm going to put this pillow. Actually, you don't need it. You don't need it, actually. Matthew has a flat back more than a lordosis, so we're not going to use a pillow for him, where if you saw somebody that did have increased lordosis and they were uncomfortable in their low back and prone, you would put that pillow for the pelvis, okay, and the lordosis. So let's just keep that here, okay. Come towards me just a bit. Oh, actually, no, you're fine. Give me this arm. All right, perfect. Make it towel roll. So for your rotations, make sure that you have adequate support in the humerus. You don't want any protrusion or anterior displacement of the humerus. You want it fully supported, so even if you have to turn the towel, you can do so, just like that. You want it level, okay, so you want that humeral head to roll nicely, or I should say spin nicely into the glenoid. So your rotation is going to look like this for external and this for internal, okay? So this is fighting gravity. So for against gravity, infraspinatus teres minor, I'm going to have you do that motion for me, Matthew. It's going to let him do it by himself. Go ahead. Good. All right. And now I'm going to apply the brake test. So the brake test is going to be mid-range, which was about here, and I'm going to be on the forearm, the distal forearm. Now, I'm not going to stabilize ever on the muscle belly. I'm going to be opposite shoulder. So come up and meet my hand, Matthew. Don't let me push you down. Hold it, hold it, hold it. Good. Okay. And he's strong. He's 5 out of 5. Let's see what happens with subscapularis. Okay, so this way is going to be internal rotation. So I'm going to have him do that motion. Go ahead. Good. Okay, try not to lift. So watch for compensations and don't let your patient use any of their shoulder muscles that you don't want to achieve the motion. So wherever their mid-range is, you go ahead and get your hands set. So go ahead and come meet my hand. Don't let me push you down, Matthew. Hold it, hold it, hold it. And he's a little weak there. I would say that he's a 4+. So remember your grades. As soon as you get that grade, you don't do the brake test twice. You see the adequate muscle strength that the patient has and you document. So 4+ out of 5 would be near max resistance. Okay, and just make sure we did everything that we did. Yeah, so we did that one. Okay, I think we're done. Thank you.